Okay, we're going to do some trach care for Mrs. Smith. Before we go into the room, I'm going to look over the patient's chart, make sure I have everything I need. I'm going to need a trach care kit, a sterile suction kit, suction canister. I'm going to need a trach mask to oxygenate my patient, and also a resuscitation bag. Also, I might need to grab any other extra PPE that might not be in the room, like a face mask. We're going to go ahead and start trach care on Mrs. Smith. I'll knock on the door, introduce myself. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory care team here at the hospital. Today we're going to go ahead and do some trach care. Okay, so first thing I'm going to do is make sure I set up the suction. I'm going to just listen to your breath sounds here. I'll monitor my patient, listening to her breath sounds, checking her SpO2, her heart rate, and anything else here. I'm going to check her cuff pressure to make sure it's between 20 and 30 centimeters of H2O. And then I'm going to go ahead and start the sterile portion of the trach care. So we need to do sterile suctioning. The first thing we're going to do. I'm going to hyperoxygenate Mrs. Smith. We're going to go ahead and open up our sterile suctioning kit. There's a set of gloves. I'll have one clean hand, one sterile hand. I'll put some lube in my sterile hand and hold onto the catheter with my sterile hand. Hook up the catheter to the suction device, and then we can go ahead and suction Mrs. Smith here. Upon inserting, when I feel a little resistance, I know I've hit the carina, so I want to make sure I back up and go ahead and include the thumb port and suction the patient out. Give her some more oxygen after we did that, and then I'll go ahead and set up my trach care. All right, Mrs. Smith, let's go ahead. I'm going to go ahead and take this inner cannula out. This one's a disposable inner cannula. Some of them are non-disposable. So in the trach care kit, there is stuff to clean it, some pipettes here, and some saline that we can use just to clean it in a basin. So you can see, we'll just clean it out like that. And let that air dry. There's some gauze. You can let it air dry. Next thing I'm going to go ahead and do is untie the trach collar, and I'll take out this gauze. We're going to go ahead and use a sterile saline in this other basin that we have and get our Q-tips. We'll go ahead and start from the inner portion and swipe outward, disposing of each Q-tip each time and doing it again until the area is clean. And making sure that we monitor the stoma site, making sure there's no abnormal drainage, pus, redness, irritation, things like that. We'll go ahead and do the other side as well. And then I'm going to put a clean gauze around the trach here. And a new tie around the trach. We can go ahead and insert the new inner cannula. I want to make sure that we have our trach patients, we always have extra inner cannulas in the room. We want a size smaller as well, just in case there's any swelling or change in the anatomy that we can easily assess and put it in there. We can go ahead and clean everything up, put it away, make sure Mrs. Smith is clean and comfortable, in a comfortable position. Discuss her one last time before we're done. I'll listen to her breath sounds. I'm going to check that cuff pressure again and make sure everything is good. Make sure Mrs. Smith is comfortable. She has her call light and she can call if she needs anything. I'll go ahead and document any findings that I have and communicate with my nurse that that trach care was done.